So here is the roster of all of our volunteers. And we have in the top row, we have the team leaders. And Dr. Trần Kiều is one of the co-founder of the organization. And me, the second person on the fourth row. I'm the lead of the administration. And we have Dr. Nathan Nhất Lê. He's the co-lead of the team. And Dr. Luận Nguyễn. And we have 9 surgeons. Actually, we registered 10 surgeons, but one surgeon, she just gave birth to the baby in May, so she withdrew from the team 2 days ago. So we went down from 10 surgeons to 9. And for the anesthesia team, we have 6. We had Dr. Nathan Lee as a lead, and we had Dr. Andrew Nguyễn. And we have Dr. Tuấn Mai and Dr. Ginny Kim, and we have 2 nurse anesthetists. I'm sorry, I couldn't. And we had 2 pediatric, Dr. Stephen Lưu and Dr. Elizabeth Nguyễn. And we have 2 pharmacists, Hồng Nguyễn and Thu Phùng, sorry. And on the dentistry side, we have 3 dentists. And we have a lot of nurses. Welcome all the return nurse and all the new nurses. As you see right here, we have all the nurses on our team this year. And we have the administration team, and I'm the leader of that team. And Thị Sang Nguyễn is taking care of the financial and the food, and Mark Nguyễn for activities and the playground for the kids, and Anthony Lâm, he will help like general. He's very handy. He handle everything, like whatever a whole bunch of unnamed tasks. He can handle everything. And we have anh Dũng Nguyễn, he's the IT lead, and Josephine Tú, she has been with us for many years, and she is lovely. She very, very sharp, and she handle all the taking care of all the kids very well. And we also have Văn Lê, and her English name is Tina, and she's in Vietnam. She will help us to coordinate the bus, finding the restaurant, and all the logistics in Vietnam for us. And we also have 6 student volunteers. And all of them are college students. And Andrea Phùng, she went with us last year, and this year she returned, and Emily and Madison also returned volunteer. And we have 3 new student volunteer. We have Alice Phùng, have Helen Nguyễn, and Dylan Nguyễn. And while we are in Vietnam, we also have a US-based specialist consultant. They will stand by just in case if we need any assistance, any consultant. We will call them and ask for their advice. Those are the list of all the volunteers we have this year. I hope that I did not miss anyone. So if you don't see your photo in here, please let me know. Or if you would like to change your photo, let me know, because these are the photos that you submit to me, to us, and I just copy it out and we put on just wrote the list. And So I'm waiting for Dr. Nathan Lee to sign in. He's at work right now. He works at Kaiser Hospital. So hopefully he can sign in. Then he will talk to us about the medical mission, about all the tasks, and how he's the coordinator of all the medical and non-medical volunteers. So he would know better than me on the medical side. I am the leader of the administration side, so I will take care of all the paperwork and all the logistics. So, and while we are waiting for him, and let me go over some of the non-medical things. Okay, so let me go through all the non-medical things, and if you have questions, save your question into the end, and you may ask a question. I will try to answer to all the questions that you have. First, about the hotel. We will stay at the hotel named New World Saigon Hotel. It's on the Lê Lai Street in the 1st district of Ho Chi Minh City, in the Saigon. And let me see if we can bring up the map so you will have an idea of the location. Do you see the map? Okay, thank you. And so here is the airport on the top left corner, and we are along the Saigon River, and the hotel will be at the Bến Thành Market. So they just built the metro station, the first metro in Saigon, in southern of Vietnam, and the hotel is right next to the metro. Not when I say next, it's not really not like next door, but it's nearby. So from the hotel, you can walk to the walking street. It's not far. This is the Bến Thành Market, and we have over here is the walking street. So people gather at night time and to cool down, because it kind of hot, humid and hot during the day, but at night time it cool down, and so a lot of people go out to the street and also to the river bank. This is the Saigon River. Okay, so there is one announcement from Tisa Nguyen, who in charge of the hotel. She told me that to let you guys know, if you stay one extra, like any extra day, each extra night cost is $88 a room. So if you stay single, so it's $88 for you a night. I'm talking about extra night, not the work week from Saturday Saturday the 13th to the 20th. That's already covered. But if you stay extra, you come early or you stay back, so the one night is $88 a room. And if you share room with another person, then you split the cost among yourself. For the airport pickup, PVNF would hire a bus to pick up all the volunteers who arrive on Saturday, September 13, between 8 a.m. and 12 noon. So we have the spreadsheet, the share spreadsheet. I put it on, and I announced this couple times. So make sure that you enter your arrival time. So let me know that what time you come in. If you coming in during the pickup time, so I would have a head count, and I will hire a bus, a right size bus, to pick up all of you. And for those who arrive outside of the time window that I just I mentioned before, that I hope that you arrange your own transportation. The taxi cost in Saigon is about $6 for a trip from the airport to the hotel. And if you haven't been to Vietnam, in Vietnam they have taxi. It's not a taxi company, but like it's very much like Uber in the US. They call Grab, and you can hire a Grab car, and you download the app on your phone, and you use the app to book your trip, and the app will tell you exactly how much it costs. So it's more convenient to use the Grab than you have a taxi and you don't know how much it costs. It may running around, the cities, and you don't know you don't know the direction, and you'll be like overcharged for your trip. So it's better to use Grab. And if you use Grab, it requires the app you have to download on your phone, and it's better to download on your phone when you are in Vietnam. The reason is when you open the app for the first time, it asks you to register, and it asks for a phone number. So if you activate it in the US or in Germany or wherever the country that you live in, and you're using your phone number, and when you come to Vietnam, when you have a Grab car, and the driver usually they call back the phone number you register to confirm the ride. And when they unable to call you back, they may think that you no longer interested in having a ride, and they may cancel you, and without your notice. So you keep waiting, and you don't see anyone coming, but actually they may already cancel your trip because they could not contact you. It happened to me at the first time, like 7 years ago, when I go on the mission, and it happened to me. So I learned from there. So when you go to the airport, when you arrive at the Tân Airport in Vietnam, they have free Wi-Fi, and you connect to the free Wi-Fi, and you download the Grab app, and you activate it, and you can use it in Vietnam. And if you the next thing is the Wi-Fi. The airport have free Wi-Fi, and the hotel have free Wi-Fi, and most of the restaurants in Vietnam also have given out free Wi-Fi. So you can use it to communicate using like the Wi-Fi based app like WhatsApp or Viber. But if you also travel and you want to make some phone call, and you may want to buy the physical SIM, and the physical SIM can be bought when you go outside of the door to the curve at the airport. It means like, so when you arrive at the airport, the first stop you will be is the immigration. After immigration, you go downstairs to the to collect your luggage. Then you push out of to the door, the glass door, glass sliding door. Outside a glass sliding door, like there will be a booth to with the the booth they selling the Wi-Fi and physical SIM. And if you don't know how to put it on, you just give it to your phone to them, and you buy the whatever package that fit your need, and they will activate it for you. A few years ago, the cost is about like 300 Vietnam dong, 300,000 Vietnam dong. So it's about $12 to 12 US dollar. So I don't know about this year. So, but nowadays people most of people the smartphone will have eSIM, And I travel to the Europe, and other North American country. I using like the eSIM on my phone, and it worked very well. So I will put it up here for you. I will put it in the chat, so you will see that they call it UBG company. So PVNF do not like promote any provider, or I do not affiliate any provider. This is just my personal experience. So I use this company. First I use the other company, a Wi-Fi provider, but it's not reliable. So another person like recommend this company. So they call UBG, UBIGI, and I use this for 3 years everywhere I go in Europe and North American country. And last March I went to South Korea, and it worked very well. So, and I have a discount code that for the first time user, you will have a 20% discount. So if you need eSIM and you want discount code, let me know, so I will share it with you. And like I said earlier, that WhatsApp is the Wi-Fi based application on your smartphone. You can use this to call, to make the call, or you send a message, and it requires Wi-Fi. Like I say, there are free Wi-Fi in the restaurant, in hotel, in the airport. And so if even you don't have the eSIM or the physical SIM, and you just stop by some of the shop on a street or in the airport, in the hotel, they still be able to make the phone call or message using WhatsApp. And we use it in the past 3 missions, and it worked very well. So we will use WhatsApp as the primary communication channel for all of us. So I will keep you all of you posted on any news or any changes during the mission, like any announcement about where the bus will pick up and located, and what time we have lunch, what time we have dinner, things like that. I will post it into the WhatsApp as the event coming. So you in the hospital where we work, there also Wi-Fi. So most of you already download and activate the Wi-Fi WhatsApp application. So if you haven't download or haven't joined the team, please do so promptly. So like some of you will need to be picked up at the airport. So I recommend when you arrive the airport in Saigon, so you like kind of keep us posted your location. Like in the past, most volunteer will put in a WhatsApp that, oh, I arrived at the airport and in line at the immigration, or I'm at the luggage, the conveyor, and picking up the luggage and waiting for my luggage. So if you lost your luggage and you don't know what to do, and so also let us know. Things like that, we will assist you in anything that we can do. Then for those to be picked up, and myself will be outside of the sliding door waiting for you out there with a sign PVNF, and you will recognize us, and we'll gather together in one place. Then I will call the bus. I will walk to the bus, and we will go. The bus will take us to the hotel. And I did send out the information about the final payment. If you haven't paid off your final balance, please do so promptly. The deadline is July 15. For the visa, the PVNF will apply for a working visa for you. And because volunteer work in Vietnam is considered to be working like any other field worker, So we have to have a working visa, then PVNF will apply it for you. And the visa will valid from September 11 to September 22nd. That's a 2 days before the mission and 2 days after the mission. And some of the volunteer would like to have like one extra day or come 1 day earlier than that. Please let me know. So I would try to request to extend your working visa so you don't have to pay for tourist visa. But if you stay longer than 1 day or 2 days, I recommend you to apply for the e-visa. The e-visa fee is $25 for single entry and $50 for multiple entry. If you want to apply for e-visa, yeah, contact me. So I will share with you the link to the website, the official website. If you search on the Google, and there will be a whole bunch of the agency that help you to do that, and they charge a fee for that, but you don't have to. You can go directly to the e-visa website of the Vietnamese government and you can apply directly. So when you apply for the e-visa, it will ask you the hotel where you stay and how long you stay there. And if you need the hotel address, let me know. I think I already sent it out in one of the email, but in case if you couldn't find it, let me know. I will share with you the address of the hotel. So we already submit all our paperwork for the working visa, and we expect to receive it by the end of August. So when we receive it, we will notify you for pickup. And for people in long distance from the Orange County, then we will mail it to you. And during the work week, we all stay in the same hotel. The name of hotel is New World in Saigon. And each day there will be 2 buses that take us to the hospital where we work, then to the restaurant for dinner, and take us back to the hotel. So we all ride on the same 2 buses every day. In the morning, we'll have breakfast at the hotel, and we'll have lunch at the work site. And we have lunch box, and at the work site, because during the work day, we have about 30-minute break for lunch around noon time. So we don't have enough time to go outside of the hospital. The travel time will be take up all of our time. And at night time, we'll go to the dinner at a restaurant. We'll change like different restaurant each day. On Tuesday and Thursday, the team dinner is optional. So on the other day, like on Saturday, the first Saturday night, Sunday, on Monday, we always have dinner together so we can bond and we can share experience and we can discuss about work, about anything that related to work. But on Tuesday and Thursday is are optional because some of the volunteer have the friend and relative in Saigon and they would like to spend some time with their friend or family. So if you do, you can take off on Tuesday or Thursday, and the cutoff time in noon. So let us know that you don't join the team for dinner. So we don't like order the food and pay, because otherwise we have to, we don't know that you opt out on that night. So we still reserve many seats and we still have to pay for the dinner. So we don't want to waste that. And on the Friday, we have a farewell dinner. And at that time, like on Friday, the work will end around like 3 p.m. Then we pack up and we have time to go back to the hotel and relax and change to a nicer clothes. The clothes. So bring a semi-formal dress for you for that night, the Friday night. Some people wear áo dài, some people wear dress, and you don't have to go fully like formal, like tuxedo or anything like that. Just be comfortable because we travel, we don't cannot pack a lot in our luggage. And personal medicine, please bring all your needed medicine with you. And if you have jet lag, you may bring like sleeping medicine, sleeping pill, and you take it as needed. Like in the past, like some volunteer like have jet lag and could not sleep for like 2 3 days, and they are so tired at work they almost like non-functional. So we don't want that to happen. So the team need you and the patient need you. So members of the surgery. Okay, so it's very humid in Saigon in September because it's still in the raining season. It may rain occasionally, and if you lose your sleep and you stay extra day in the hot and humid weather, you may drain out very quickly. So drink a lot of water, and you may want to bring some like emergency or maybe an or liquid IV with you. So you can buy them at Costco or Sam or the supermarket or a pharmacy. So and the next thing is when you travel, like, when most of us when travel, we love to have the street food. We want to go to the street, uh, go down to the street at night time and enjoy street food. But however, we are on a medical mission trip, so every one of you are non-replaceable. We need you and the team need you, and the patient also need you. So take care of yourself and don't go out and eat street food and you have a stomach ache and next day and you have diarrhea and you cannot come to work, and we will be short of staff, and we may have to reschedule surgery for the patient, and it would be difficult for us and for the team and for the patient. So please take care of yourself and make sure that you'll be ready at the bus in front of the hotel at 7 a.m. every working day. So the bus will leave because the patient is waiting at the hospital, and we had to be there and set up, then start to do our work at 8 o'clock. So be promptly. The bus may leave without you if you are late, and if you miss the bus, then let me using the WhatsApp to contact me, so I will arrange the taxi to take you to the hotel. But that's it. We
Of
don't want
course.
to do that because there is a lot of like volunteer. Like we have 55 volunteer. So I hope everyone will cooperate and work well with us so we can have a smooth transition from hotel to the work site to dinners and go back to the hotel. And we want to have a safe, a very safe trip for you guys. And on the last day of the trip, you will arrange your own transportation to the airport and take care of all the personal expenses at the hotel before you check out. So that's it. The, that's all from the non-medical side of the trip. Uh, do anyone have any question? If you don't ask question now, you still can ask me by send us an email. Then I will answer all your questions. Make sure that you have a good trip to Vietnam. So if you don't have any question, I would like to pass it over to Dr. Lot and Dr. Nathan Lee.
All right. Good morning, everyone. Okay. All right. Thank you, Yung, for going through all the admin portion of for us. So I know Dr. So I just want to introduce myself. I am my American name is Nathan, or I go by Nyat. I'm a pediatric anesthesiologist, and I am going to be one of the three co-lead of the surgery mission for our team this year. Okay, so together with me, with Dũng that you met, and với bác sĩ Lọt, Dr. Lọt, we are going to be the clinical and the administrative people that are going to be here with you. So before I go through my portions, I would like to ask Dr. Lott, who is our lead surgeon, so my co-lead for the surgery team, and he is the president of the Project Vietnam Foundation, to uh, to talk with you and share his thoughts with you. Are you on, Dr. Lott?
Yes, I am. Thank you.
Okay.
I'm at my office. I'm in between patients, so if I have to run out, please excuse me. On behalf of Project Vietnam Foundation and the founder, Dr. Quỳnh Kiều and Dr. Trần Kiều, we thank you for your time, your experience, and for serving the kids in Vietnam. Thank you. We also want to thank your family. Without your family's support, you won't be able to join us. And even if you can join us, without the support, you won't have a great time or a peaceful time in Vietnam. So it takes the family and also takes you supporting each other for you to be able to volunteer with us. This is my eighth time going to the mission. I'm a plastic surgeon. I practice in Southern California for 30 years, and I've been with Project Vietnam since 2016. First as a volunteer surgeon, and then they asked me to serve in other capacity. I have the honor of being the president now, and again, I thank you for your time and attention. Our team, Dr. Nathan Lee, Dr. and Dũng Vũ, our goal is to have you go into Vietnam and come back out safe. And while we're in Vietnam, we want to do everything that is safe for the patient, the children. So when we screen them, we screen to see whether we can help them, but also to screen to whether we can help them safely. At times we will reject the case because it's beyond our capacity or is not safe for the patient. So try to emphasize about that.
They're all good.
And then the other thing is that right now we have scheduled approximately 131 patients that will be screening on Sunday, September 14th, I believe.
I'll do whatever, just so you make me look good.
So, but,
That's only
half
good.
of them are returning
You guys make me
patients
look good?
that we're checking up.
Let me ask
The
you
other half is a combination of new and second stage surgery patients. Second stage meaning that they had the lip done, but this year they're coming back to have their palate done. We are planning to have 5 operating tables. We had 10 surgeons volunteer. One of them has withdrew. Dr. Annie Do works at Chalk Hospital in Southern California. She had to withdraw because she just recently had a baby, and she wanted to bring the baby to Vietnam, but the baby's a little too young, so she ended up deciding to stay instead of going. And we support that. We would support her in any way that we can if she decides to Vietnam, but support her decision. But we're still going to try to run 5 tables. We have a combination of returning surgeons and also brand new patients. We welcome both. And I know that we have a diverse group of surgeons, some from Southern California, some from Texas, some from Seattle, Washington, some from Canada, and some from Germany. You'll get a chance to meet them all, and they're very nice, very competent, and I know they're going to take good care of the patient. So, thank you.
I have a video from our founder, Dr. Quinn Kiel and Dr. Chan Kiel. They couldn't be here because they are attending a medical meeting. So I'm going to play that. That would be a minute here. Let me see if I can start. All right, so I just want to share with you a little bit about myself. I started with PVNF in 1999, and this picture here show you uh, my very first mission was in Thanh and that's me right there. So um, back in those days, I have a little bit more black hair than I do today, but the gray is really is happy gray. So I'm happy to share this very first pictures. Uh, as you see in the video, the hospitals and the location where we're at in this previous years has been pretty much, very well, nice and equipped. But when we started in the days where that's the second person that just came on the red circle there, that's bác sĩ Trần. Dr. Chan, he is the founder and he is my mentor. He is an anesthesiologist that helped me through my very first mission. As you can see in these pictures, that's the hospital that we came.
It's
that
gonna
we
melt if you
came
take it
to,
out. So you
and
better
you can
heat it
see
the
it
moment we come
really
out.
looked like an
Heat
old
it pretty quickly.
warehouse that that we're trying to figure out what to
Absolutely.
do. And that's you can see me sitting there and the rest of us team here looking at Dr. Chan, like deers in a headlight, right? It's like, what are we going to do? Right? Looking at all of this. But that's part of the medical mission is that we have members that have been on mission trip prior that will be with us. Over half of our volunteer on the team from previous missions. So he's sitting there explaining to us, and then eventually we got the operating room up, looking like this, running two operating table at a time, and with the help of the team members and coming together, working together, we're able to get surgery through and taking care of the kids and
Maria, we
provide
forgot
them
to get change singles for
with the need that need to be done. So this will be my 24th mission, and PVNF would be 26th mission. So this is the operating room from last year. You see, it looks, besides having two patients in the operating room, it pretty much looked like an American operating room with nice lights, with, decent equipment. But the people still are the main driver behind the successful, the safe surgery for the kids. Still two operating table, and then I'm still there, and I will be there with you this coming mission. So I want to tell you the story. People frequently ask me, why do I keep coming back? So this is 15 years ago. This young boy, he was about 8, 9 years old, and he came to us, and we were in one of the small province doing surgery at that time. Uh, his deformity has been so bad that he has not been attending school, and just pretty much hiding at home, and just up to a point where the villager where he lived at, gave him the nickname of the unfortunate one. And his life have just not allow him to be a kid, allow him to go out and play and interact. So after the team did the surgery for him on that mission and came to realize and understand his situation outside besides the appearance and the deformities um, that we see there, we realized that he was so far back from behind in school. So the team got together, took up the little collections, hired tutors for him to help catch him up. So a few years later, um, we were able to follow up with him. And remember, this is back in the days where it's extremely hard to, there's no cell phone and email, which is something fairly um, hard to get. So a few years later, we were able to follow up with the family, and the parents share with us that, you know what, this young boy is now one of the top student in his school, and and he is doing so well at school. He's playing with the other kids and really became a good, solid student. And at this point, the villager ended up giving him a nickname as the lucky one. So it really, this child really is a good example to for me to know that what we do is on this mission. Yes, we correct the deformities, we improve the appearance, but it go much deeper than that. We actually changing the life of these children. We put them on a whole different trajectory in life. So for this time, up to this time, Project Vietnam has performed surgery for 2,328 children over the last 25 missions of work that we do. So the next question most people ask me would be, how is that Vietnam has so many kids that have cleft lip and palates like this that we don't see here in America? And for this year, I went back and did a little research, and it's really neat. Is that I found a study that was just been done by a joint effort between Japan and Hanoi Medical School, and the uh, the statistic shows that every year, um, globally, about 1.08 birth out of 1,000 kids have either cleft lip, cleft palates, a combination of cleft lip and cleft palates. In Asia, particularly, in Asia and Native American and Hispanic populations, we have almost twice the amount, two birth out of 1,000 that have this craniofacial deformity. And particularly in Vietnam, our number is somewhere in the middle, is about 1.4 birth out of 1,000. So Vietnam, as compared to America, we got about 40% more. But compared globally or other high risk populations were actually it's a little bit lower. But what's unique about Vietnam of being a third world country is that the estimated about 3,000 children are born yearly with this craniofacial deformity. And because we are a third world country, only about not quite 50% of the patient have any access to a surgery that will fix these deformities. So if you look at it, in Vietnam, about 1,500 new births that are that left behind without access to healthcare. But most of this are they live in the fringe of society, they're out in the small provinces that don't have, first, they don't have this kind of specialty surgery available to them. Second is that they can't afford it. And thirdly is that basic healthcare is not even available. So for them, seeking healthcare for this kind of surgery is um, almost non-existent, So that's where the medical mission team like us come in. So as Dr. Lott presented the patient case that we do, every year we do anywhere between 70, 80 to 90 patients. About 40 or 50 of them are new patients, and then the remaining 20 to 30 are either return patients that they get the second stage or the third stage done, or they have fistulas and things that we need to repair. So, team like us, we actually in general do a higher volume than a lot of the other medical mission team that go to third world countries. And I'll explain to you a little bit more in a minute as to why we're able to perform more surgery and taking on the more complex cases. But if you look at it, every year for us to be able to take care of all the kids in Vietnam, we will need around 30 to 40 teams or missions to be able to take care of the kids, and it doesn't happen that way. particularly after COVID, the number of teams that are able to travel to third world countries, particularly Vietnam, has dropped substantially. The question comes, how come we don't see them in America? As Dr. Lott explained to you, most kids with a cleft lip get the surgery done before they turn 6, 7 months old. So in the United States, healthcare is available, this kind of surgery available to all citizens of the United States. You may have to travel a little bit far outside of your hometown, but most parents would keep the kids at home, uh, until they get the surgery done. So people outside of the immediate family don't even know that the kids have a cleft lip or cleft palate until they get it fixed. So most of us in public will never see them before they get the cleft lip fixed, and then the cleft palate usually get done by the time they turn a year old. Give or take a few months. And then the rhinoplasty, which is the third stage where we fix the nose as they're growing up and make it more even instead of the semi-collapsed nose, that get done in the teenage. So most of the kids here in the state get those done. So that's really is the the main reason why we don't see them as much here in the States. So, kids, sometimes we feel that kids at early age don't really know what's going on. But uh, this one kid here, I would tell you, he was no more than 4 or 5 years old. And he was sitting in the waiting room when I came in to examine him. And he just jumped off his mom's lap, ran over to me, pulled up his shirt, you know, and just ready to wait for me to examine him. And this little young boys always remind me of, because in the United States, when I take care of kids, usually they are so cling on to their parents. They would cry when they have any inclination that, a complete stranger was about to take them, and that separation anxiety is extremely high. But these kids have been sitting there all morning watching me coming in and taking other kids, and other anesthesiologists pick up other kids. So when I called his name, he was so excited. And later his mom told me that he has just been waiting uh, to for his turn. And mom has been explaining to him that somehow this day he knew something very special about to happen for him. He's one that doesn't have a cleft lip, but just have a cleft palate. So he hasn't been able to eat well. He hasn't been able to talk like other kids at his age, and the social impact, the psychological impact on these kids are pretty significant. And he really wanted to point out to me that you know he knows and he looked forward to having something done that will help him. So as you can see, he was just happy walking down the hallway with me and to go to surgery. I think inside somehow he knew today was the day that something something very special is about to happen for him. So this are the kind of experience that we have coming on this mission. So each one of us sign up to come on the missions. I think we all have the same or similar goal of giving back, taking care of the people that uh, are can't have access to healthcare in a country that opportunity is so scarce already. And if you have any sort of deformities, that puts you even further back. So just to remember every surgery that we do for these children, we every surgery just give them an opportunity to just change their life story. And this is a chance that for us to come together and um, and to do things that are greater than ourselves. So let me tell you, for our team here, what make us give us the ability to perform the surgery, but we take on a lot more complex kids that are frequently get turned down by other team that has come. Because you can see we have a team of now 9 surgeons, and out of this group of surgeons, 7 of them are or six of them are returning surgeons, so they have experience with us. We've been working together as a team for over the years. Um, all of us are coming from different part of the states, different part of the country, different part of the continent, and then we get to meet once together once a year on this mission team, and we are expected to be able to work, you know, like a well-oiled machine, like how you work at your facility each and every day. So, our anesthesia team, we have six providers, four physicians and two nurse anesthetists. And out of the six here, four of us are been with PVNF for multiple years. And what's very unique about our team that allow us to take care of some of the kids with other comorbidity, we have a neonatologist and pediatricians on the team. They will help us co-manage this kids through and through, and work together with the hospital pediatricians um, to um, to take care of the kids through the whole time, pre-op, intra-op, and then post-op care. And then we have two pharmacists that will help us, manage some of the more unique situation with these kids, to get them at the optimal medical condition before heading into surgery, and then how to take care of their pain and prevent infections and things afterward. And then over the years, we are trying to develop additional repair for the kids that besides doing the cleft lip, cleft palates, their teeth are malaligned. And in the United States, you have an orthodontist that will follow them through and through over the year to help align them. Uh, we don't have that luxury on for these kids when they live in an area where there's no orthodontist available. And even if they are available, they can't afford them. So we have put together a dental team that have been working to find more simple ways to help uh, align these kids' teeth uh, to somewhat of a situation that put them in a better alignment as they're growing up. So that's it's a work in progress, and they're actively working. They started the program last year, and looking forward to continue to develop that part of it. And then we have a nursing team. We have 21 nurses and OR surgical tech that will be supporting our surgery, our pre-op, our post-op. And of the nursing team, we over half of them are also returning nurses. So for all the new nurses that are going to be with us, you are in good hands because you will have good mentors that will work with you and carry you through. For our patients, we really support them from A through Z during the time they're with us. We really want to give them an experience and an operation that the best that we can offer them. So that's the key goal for our surgery team is not just do something a little better for them, which is what we started out with back in 1999 and those early years, where we didn't have a lot to offer these kids, but we could have something to offer that is better than what they are what they have at home. But over the years, I have experienced that the the amount of talents that we have on our team, the people, all of you are just highly specialized in the field that you work at home here in the United States. And also, particularly for me, is that I realize that besides being a pediatric anesthesiologist, I run operation for my group here at Kaiser in Orange County for, over a decade. Uh, I want to bring some of that there for them. I want to give them the best that we collectively and me individually and each one of us individually can do and bring the same level of healthcare that we provide for our patient in the state to them. And offering them just something better is good, but offering them the best that we can give them um, is what I think these children really deserve, and is an opportunity for them to feel like they are the most important patient, the most important person being here with us. So we look forward to just change them physically, emotionally, and psychologically that will allow them a boost to to make it an experience that is the turning point in their life. So in order to achieve all of that, besides all the medical specialists that we have on the team, we have a group of 7 administrators that constantly working in the background, taking care of everything that the volunteers on our team need from, like you explained to you, the paperwork, um, transportation, eating, hotel and all of that for us. They're also out there taking care of this patients. And with the patients come the parents. Because in the Vietnam hospital, nurses, the host hospital nurse take care of the medical need for the patient, but they don't take care of anything else. Unlike in the States where the parents can just come to visit and be with the kids when they can and then they leave. But in Vietnam, they stay with the kids throughout the whole week. So, our team take care of them because we know that they uh, financially they can't afford any of this. So we don't charge the family any money. We pay the hospital for the expense of uh, uh, for the supplies and the hospital stay and all of the normal expense that the hospital has to put out. And the hospital is an excellent host hospital that we have worked with over the years for multiple years, and they charge us just the minimal cost, the bare minimal cost, and they give what they can. But as you know, even in this pretty well-run hospital, their budget, their finance is pretty tight. So we don't want to be a burden on them. So we pay for the expense. And for the children, we also pay for their travel expense. Some of this family, we come to know that they sell off the family cow. They borrow money from their neighbors just to pay for the transportation to us. So, and it come down to a few $100 total. So we want for the family to be able to financially get back to where they started. And that's where all the fundraiser and the money that the foundation make go toward. And that is a commitment that we have made as a team of all the volunteer for Project Vietnam is that we will pay our own way. So that's why there's a mission cost for all of us. We pay for our hotel, our food, our transportation, so that whatever money that you raise for us, whatever money our donors give to us, we put them all toward the care of the children. And what's unique about our team is also we have students that are volunteering with us. So this year we have 6 students that they're all looking to go into healthcare. And having all of you being their mentor really gives them the right perspective of what the healthcare is about. Taking care of patients in the United States, having a good career, financially being stable, and but also there's a whole different aspect. For me, for a week out of the year, uh, it really balanced out my whole year worth of working here in the States. And it really allowed us to each one of us to complement and fill our career with really neat experience that I tell you, I the kind of experience that our volunteer have out of the week is very unique and it's something of your own that you keep deep inside your heart and it somehow drive you and it somehow will propel you throughout your career and your time. And we look forward to coming back the following year. And for our team, in order, we are unique as well that I have uh, some specialists that serve as consultant. They can't travel to Vietnam with us, so they are here in the United States. Dr. Lowe, who is a pediatric cardiologist that I worked with for multiple years, I worked with for several decades here at Kaiser. He's actually is an amazing doctor that made himself available to our team. So whenever I have a complicated patient, in Vietnam, I can send the kid to get an echocardiogram done. But reading it and understanding the result is a whole different ball game for me. So try to translate them over to English, and then I would call Dr. Lowe up, and on WhatsApp I send him pictures of the echo, and together he can read them with me, and then give me recommendation of how to manage some of these kids with more complicated cardiac comorbidity. Um, and there has been kids that he looked at and he said, you know what, this kid really need to have cardiac surgery first before you do any other surgery. So it's just reassurance of having a highly specialized physicians to help us make out the best decision that we can for this kid. And likewise, Dr. Patrick Van Winkle is a pediatric hospitalist that help guide the management of our kids. So many of our kids come from the provinces, and when they come into the city, they get exposure to a huge amount of pollutant. And respiratory situation is sometimes can be quite challenging, or they have some other comorbidity. So together with him and our two pediatrician neonatologists here, they can really help manage this kid and then try to optimize their condition before surgery and trying to take care of them after surgery. And then there also been years where we do X-ray of some of these kids and we have trouble reading them. For our pediatric patient population, the hospital have radiologists, but they are adult radiologists. So Dr. Nguyen here is a radiologist in the States that also very highly trained with kids as well as adults. So he'll help, I can take a picture of the X-ray or go on a live stream and have him look through X-ray and really help guide us in that way. And he is my nephew, and I still remember the day where I used to babysit him and was just taking care of him, and now he's a full-fledged practicing physician over the years. But it's nice to have my own family and my own nephews and nieces that are coming around to help us on this mission. So that's the composite of our team. I know you went through what the week looks like, so I'm going to share with you a little bit. Here is the schedule for the week. So I'm going to just briefly walk you through the week so you know what to expect. I'm going to arrive there on Friday, and on Saturday, I'm going to start in the middle from noon on. There's a group of us that will be setting up the hospital space to convert them into our hospital clinic. So on Sunday, we will be running a patient evaluation clinic. So this is what kind of like the layout for the clinic and what it looks like. And as you can see, we're going from station one, which is registration, to station two, where the surgeon will evaluate the patient to determine if they are surgical candidates, and if they are, what kind of surgical procedure that are going to be best for them. So our 9 surgeons will be working together, and collectively they will share their evaluations and recommendation. And then they go to vital sign, we take pictures, and then we have our pediatricians evaluate them to make sure that whatever the underlying medical condition is something that is safely can be managed. And then the next station they'll go to is that they will get a anesthesia evaluations. And after the anesthesia evaluation, so these are the three components. We operate with a protocol that the surgeon, the pediatrician, the anesthesiologist have the same agreement that this patient can be managed by our team safely. So that's how we want to make sure that we able to manage and provide the safest surgery for these kids. And then they go and they tell dentists to get evaluation for their dental care, and then we will admit the patient to the hospital. So that's what we are going to spend our Sunday doing, and Sunday morning we are going to start. Let me see. Somehow I am not able to advance the PowerPoint. Okay. So anyway, I'm just gonna tell you. So Sunday morning is a little bit of a later start. So usually in the morning, we start the bus leave on Sunday at 8 a.m. and breakfast start at 6. So it's available at 6. So we will start our breakfast, and then we will have a little bit team meeting. And people say 6 o'clock for breakfast is pretty early, but you know what? Most of us, because of the time difference, will wake up around 3 or 4 in the morning. We go, and the hotel should have a gym that we can go and exercise, and most people would do that, and they're anxiously waiting to get started. So we get to the hospital at about 8:30. We'll help set up clinic. I will be sending out a assignment for Sunday in the next couple of weeks, so that we will know what station we are going to be staffing, and then we will do screening, and then we'll have lunch there. But the screening usually will run to about 3 or 4 o'clock in the afternoon. And at that time, we will have a team conference to go through all the cases with our surgeons, our anesthesiologists, our pediatricians, and our nurses, to make sure that we can support the type of procedure that we're going to have for the kids. And then we'll be returning back to the hotel around 5 p.m. or so. And people will have a little bit of time to rest. And at 6 o'clock, we will have a team dinner. And it gives us a chance to have our team bond, and for us to reflect on the experience that we have, and then also a chance for us to discuss and answer questions. And around 7:30, we are going to meet individually to talk about and plan for Monday. So we have 5 days of surgery from Monday to Friday. So Monday, we're going to hit the ground running. So from that point on, Monday through Friday, the bus leave at 7 a.m. And it's actually is a very good time. It's not too early. Once again, because of the time difference. So every morning, you can come down for breakfast when that's convenience for you. But around 6:45, we're going to have a team briefing in the morning. And then by 7 a.m., the bus leaves. So it's not 7 a.m. that I'm going to be thinking about walking down to the bus, but at 7 a.m. the bus leave. So from 6:45 to about 6:50, five, we will talk, and then at 6:55 we all just go together to the bus. And the important thing is that we need to get to the hospital by 7:30, get set up, and on Monday we would running our surgery schedule a little bit lighter. That just allow us a chance to make sure that we get everything up and running and get everything working appropriately. So we will take it easy on Monday to get uh, everything in place. Tuesday, Wednesday, and Thursday are going to be our heavy days. So we do the more complicated patient. We're likely to operate longer days. And our goal is to be done around 4 o'clock in the afternoon, and return to the hotel at 5 or 6 in the evening and to have dinner together. To be honest with you, there has been years where we have complicated patients, and I would stay till 7 or 8 o'clock at night if needed. And a lot of our volunteer will just volunteer to stay. And so that's at that time we will divide up the team a little bit. Some will stay, some will go home. Because the important thing is that we need to have people. As much as you want to stay, we also need people to have dinner, rest for the night, and get started early the next morning. So we appreciate and need your help late in the evening sometime when needed, but we also need you to be ready to go for the remainder of the week. The work condition is very unique. Environmentally, it's hot, it's humid. We have air conditioners inside the operating room, but frequently it's not really sufficient to keep us comfortable. It can be stressful. Kids situations, supply, equipment can be lacking, and it draw on all of us to bring our best innovations, creativity, and piece it together so that we all can work together, come out with great solutions. The most important thing, we don't want anyone to do anything that are risky, or things that you are not trained to do. So that's the really key thing for the mission, is that we want you to be creative. We want you to draw from all your experience, in your training, and we want you discover sometimes you discover skills and talents that you didn't even know that you have. But the important thing is that we are not going to experiment or taking any chances for the safety of our kids. But collectively, I think we can do a lot more than what we normally do here at home. But that is going to be a collective effort. And then on Friday, it's going to be a lighter day because we need to clean up on Friday afternoon, and we also need to manage these kids, for the recovery period of time. The team can be done by Saturday, and then Saturday, you are free to do whatever you like or travel and things like that. But there's a few of us that will stay behind, and then we also have specialists in Vietnam that the team have been working with the doctors that will continue to round on the patients until the last patient get discharged home, which is somewhere between Wednesday and Thursday of the following week. So that's the what the work week is like. And the kids that the ultimate outcome for the week. This is the example of some of the kids that we took care of last year. And you can see, you know, this is what we all are looking you know, to be a part of. The kids, as some of them are unrecognizable. And if you can see in the video last year, there was a aunt who have taken care of a kids that was somewhat abandoned by the parents. After the surgery, we
Yeah, we
call
have
her
to
to
do it on
go
our phone.
and take to be with her kids that they heading out to the room. She didn't even recognize her nephew, and she keeps going, I don't think that's my kid. Not until she looked at the armband or the ankle band and realized that it is her nephew, and that's the significant the change that the pronounced change that you can see, and you can see this kids here from the before and after pictures. You have to really look carefully, look at the eyes and the facial to realize that it's the same kids, but the transformation is can be just incredibly rewarding to see. And the last kid on the right, we brought home some of those, princess dress that our kids have outgrown. And you can see her after her surgery, and she had been recovered just a couple of days. There's a video that I couldn't get to work, but she was dancing around. This is the happiest day for for them. So, uh, so overall, I just want to leave you with a few reminders. Is that you already went through the preparation, but between now and then, you just gather your tools of the trade. Make sure you have the proper vaccination, preparation for whatever medication you normally take, or sleep aids or things like that. And the one thing that I remind you is bring an extra pair of eyeglasses. Okay, sometimes things get misplaced or get dropped and broken, and when you're there, like especially for me without eyeglasses, I can't function. So stethoscope, whatever that you normally use, exercise and take your vitamins. You want to be in your best state of health because we want you to be nice and healthy and strong while you're there. We also recommend that you use travel insurance. With health coverage and the evacuation in the rare event that if something were to happen for you and we need to get you taken care of. And of course, you already went through passport, visa. I talked about comfortable clothing, and then we asked you to save, one check-in luggage, potentially to help us carry some of the mission supply. We have streamlined our supply that we bring home, but in previous mission, I have bring as many as 50, 60 boxes of supply home. This year, because Vietnam, where we are at this hospital, we can buy a lot of the basic uh, supply that we need. So we will be bringing still some, but hopefully just a dozen boxes or so. So I just ask that you will save it. Most of your travel arrangement will allow you to bring two check-in luggage. We ask you to save one for us. So at this point, I'm gonna stop and just open up for questions. Uh, Anybody have any question that you'd like to ask? so you can unmute and you can ask. Okay. If you don't have any questions, then I just want to have people just introduce themselves a little bit so that we get to know who you are. So I'm going to start with Dr. I'm going to go through my screen here, and I will start with Dr. Tony Chi. Please give us like a quick 30-second introduction of yourself.
Yeah, yeah. My name is Tony Chi, oral and maxillofacial surgeon. Been practiced in Long Beach for over 30 years, and affiliated with Long Beach Memorial and St. Mary, and covered most of the trauma course. And I've been to multiple missions, especially Cambodia, since 1911, and I'm very happy to, and also Peru mission for about 7 mission was Peru mission doing a cleft and palate. And I'm very glad to be able to participate with Project PVNF. Thank you very much.
Thank you. All right, Dr. Joseph.
Hello, I'm Joseph Huang. I'm from Victoria, Texas. I am ENT. I've been with the Project Vietnam for 3 years, and I signed up for 5-year commitment.
All right. Okay, next we have Pauline or Jenny. She's at work, and I'm glad she can join us. She is our lead nurse that will help us organize and run the operating room.
Hi, everyone. I'm glad I can make it. I was at lunch, so I'm trying to listen in. I work in Kaiser with Dr. Nathan Lay. This is going to be my 9th year with Project Vietnam. Looking forward to seeing everyone again.
All right. And then we have next is Dr. Stephen Liu.
Oh, hi, everyone. Yeah, this is Stephen Liu. I also work with Dr. Nathan Lay for the past, 17 years. The pediatrician slash neonatologist. So it's my second year, and really excited to going back.
All right. And then I will go with Michelle Ta. Michelle? Michelle, are
Yes, yes. Hi, my name is
Hi.
Michelle Perez. This is my second year. Super excited to see everyone, and I look forward to seeing these kids again. And that's it. You guys have a great Saturday.
Thank you, Michelle. All right. Jenny Nguyen.
Hi, my name is Jenny. I am a nurse at Kaiser San Diego, and this will be my first year participating in this project. So I'm really excited to get to meet everybody and work with the team. And yeah.
All right. Thank you. And then we have now you're throwing me a curveball. You have an abbreviation. Is the next person by the last name of Talavera.
Hello.
Hi.
Hi, sorry. I'm Zarina. I work at Kaiser, Anaheim. It's my first medical mission, and I'm excited to meet all of you and help the kids.
All right. Okay, Serena, thank you. All right. And then Lindsay.
Hi, good morning, everyone. My name is Lindsay Ong. I'm an RN. I work at the recovery room at Kaiser Anaheim, and this will be my first mission. So I'm excited to be a part of it.
All right. Welcome. And then Dan.
Hello, hi. This is Daniel
Perez.
Perez.
I
I
work
work
with
with
Nathan,
Nathan,
Dr.
Dr.
Nathan
Nathan
Lay
Lay
for
for
the
the
past
past
10
10
years.
years.
I
I
believe
believe
10
it's
years
10 years
already.
already.
This is my third year.
Um,
Very
very
excited
excited
again.
again.
So I,
So
ca- I
I
can't
can't
wait
wait to
to get
get
back
back
to the
to the
people,
people,
to the
to the
kids,
kids,
and see
and see
everyone.
everyone
All right.
again.
Thank you, Dan. All right. And then we have Lily.
So sorry. I don't know I need to change that. I think it's Christy, but it's under my daughter's name, Lily. How are you, Dr. Lay?
Good, thanks. All right.
Hi. So sorry. So I'm Christy Sai. I'm a CRNA at Kaiser Anaheim, and this is my first trip, so I'm super scared. I will need lots of tips and advice. And I'm traveling. I think Tina Dang is going to be on my airplane, so I'm going to Velcro myself to her. She doesn't know that, but that's what I'm going to do. And I'm excited to come hang out with everybody, and I'm really excited to be a part of making a difference.
All right. Thank you, Christy. All right. Then somebody by the iPhone 339. Who's running iPhone 339? Okay, I'm going to jump over to Dr. Andrew. Dr. Andrew, are
Hi
you there? Yes.
everyone. My name is Andrew. This is my second year going with the surgical mission. I'm really looking forward to it. And I'm also happy I got one of my really good friends, Dong, who is also very involved in global health, to come along this year too. So hopefully he can come in for many years ahead as well.
Thank you, Andrew. So Dr. Tuấn Mai, who is a friend of Andrew, he is an anesthesiologist with specialized training in intensive care, and he actually has been involved in other missions, help setting up cardiac ICU care for the kids. So I'm really excited to have Dr. Tuấn Mai on our team. Those specialized trainings really is help us uh, better and manage his children safer. As much as we want to do everything that we can for them, we still have to make sure that they are capable. The kids can manage and can carry through the surgery safely for us. All right. Anyone have any question at this point?
We still have Dr. Lisa.
Oh, Dr. Lisa. Oh, she jumped around the screen. Yeah, I see that. Lisa, Dr. Lisa, she's coming from a whole different country. All right, Lisa, just unmute yourself. Can you unmute yourself? No? All right. So Dr. Lisa is a plastic surgeon fellow, and she's been coming with us for, I think, between 2 to 3 years. And the last time she came from Germany, but I know her program put her in multiple different countries over in Europe. So I'm not quite sure which hospital she's at coming from this year. You?
She's still in Germany. I asked her earlier.
Oh, okay. All right. Because somehow I understand that I have technical difficulty too. So I just want to reassure you guys that my anesthesia skills are a lot better than my technical Zoom meeting skills. So, don't worry too much if you see that I'm fumbling on the Zoom here. All right. So if you don't have any question, just want to share with you last couple of pictures here. Okay. So this here, you can see this is the pictures of our team uh, from last year. And what's really unique here, if you see the circle that I circled for you. So you remember the first picture that I showed you in 1999? There was a picture of me and Dr. Chan, who is my mentor and the co-founder of PVNF. In this picture, you can see standing there in that circle. He's still there. So he is the anchor, the goalpost for us. But what's unique is the young lady standing in front of him is his daughter. She is Dr. Kill. She is the ENT surgeon that has come back. She came on the team as a young student volunteer and came back as a surgeon with us for multiple years now. She does all the rhinoplasty for the teenage kids, and in her arms is also her daughter, who is, I think, around 3 years old and has been on more mission with us than her age in year, because she came on the very first mission when she was only a few months old. So it's really neat to see family grow together over volunteer works. So it's just neat to be with the team and to see all of us and see all of the younger volunteers, our student, eventually become practitioner. So that's the team from last year, and this year I'm looking forward to have all of you guys in these pictures when I showed next year. So I just want to leave you with the final thought is why teamwork is so critical on our mission. Our mission can only be as good, as safe, as strong as each one of us contribute together. And I just ask that, as hard as it is from time to time, the challenges that we face, because every challenge that we work together to get through are opportunity for us to grow. So, like they said, when you remove the I and replace it with a we, instantly illness become wellness. So that's what we're aimed to do. Okay. And we do it out of love, because love will transcend all barriers, and it will mutate us into a force to reckon with and beat all the challenges to reach our final destination. And our destination is to be able to together give these children a better future. And with that, I'm going to stop and once again open up for any comments or questions.
I have a question
All right.
for this. Yeah, this Tony Chi.
Yeah.
What about visa? We have to. I mean, you told us we have a working visa. So how that visa gonna come along? We get to airport and issue a visa, landing visa, or
We expect to have the working visa in our hand in the end of August, and when we have it ready, so we will email you and let you know where to pick it up. Usually, we'll pick it up in Orange County as one of our daughter office, and if you are far away, then we will mail it to you.
okay, thank you.
Okay.
Last year, last year I used my 5-year visa, which is not a working visa. Should I do that again this year?
Yes, if you have the tourist visa or the 5-year visa already, you can use it. And if you use it, then be consistent. Use the same one you exist. So don't mix between the two, because they will ask you like why you did not come in when now you come in now. So if you come in using your 5-year visas and when you exit, you also show your 5-year visa. Don't mix with the working visa.
One more question for you regarding the. I'm sorry. Yeah, Tony Chi again. You remember you want we can use the the Grab app. A lot of echo here. Can you hear me?
Yes.
Okay, how do you, I mean, you mentioned that if you use the Grab app and use US number, they may not come back to pick you up. But what number would you use? The hotel, I mean, which number would you use?
Okay, so if you have you buy the local SIM or you have eSIM,
Yeah.
yeah, then you like use that. But if you
Okay, that
use
work, huh?
the US number error code like 213-714 something like that, they unable to connect you. They cannot call overseas. So
Okay, okay.
they cannot confirm the ride. So I
So
have
we had
that
to use,
problem on the first year's automation.
so we can buy eSIM over here, right?
Uh, yeah, you could buy eSIM for over here.
Okay, got it.
All right. So in the chat, I have Dr. Stephen Liu ask me how many patients we are expecting this year. So right now we have 32 new patients sign up, and the process that we've been having patients sign up, and we are doing pre-screening from over here, and then we have about 50 patients that are going to be follow up from last year for the additional second and third stage surgery, and we have a couple of organizations, nonprofit organization in Vietnam that always bring us a group of patients. So we will get the list from them in August. So of the patient they will be bringing. So overall, our goal for this year is to operate between 80 to 90 patients for this year. All right. Anyone else have any other comments or questions? Okay, so we will have a
I'm
second
sorry, it's
meeting.
Jeannie.
Oh, Jeannie, yes.
Yeah, sorry, I was at the dentist when you mentioned my name and I couldn't open my mouth to talk. Um, but I'm Jeannie Kim. I work with Dr. Nathan Lay at Kaiser. I'm one of the anesthesiologists, and this will be my third year going. I'm really excited. I'm excited to see a lot of familiar faces and really excited to see a lot of new faces this year. Thanks so much.
All right, Jeannie, thank you. Thank you for joining us, even you're at the dentist's office. So, all right. So our second meeting will be in August, and at which point it will be more of a clinical meeting. So we are going to have Dr. Austin Gall, who is one of our main surgeon. He couldn't be here today because he's working. Is to go through the pathophysiology of cleft lip, cleft palate, and also the surgical uh, the type of surgery that I've done at various stages. And then I will go through our working protocol for, anything from NPO to other uh, uh, protocol for how we manage this patient for the week so that all of us can be on the same page. And there's an opportunity for us to just finalize all the last minute arrangement, give you all the information that you need for the travel. Before that, we're going to send out multiple uh, pieces of information to you and your team assignment and all of that. So please try your best to make it to the August meeting. I don't think we have a date finalized yet, right, you?
Not yet. It's you probably about mid of August or the third week of August.
Right. So and it's going to be on either Saturday or Sunday morning, just to make it easier for everyone to be available. So that is our main meeting. So please make every effort to be there. And if you have any questions, once again, we're open to this, to answer them at that point. And between now and then, whatever Yung sent to you is highly critical. Last 2 months now is to get all the paperwork and everything in order. I just want to leave you with a final note is that our team, there's many mission teams that come to Vietnam, and some of them don't always have the full approval of the different agency in Vietnam to ensure the safety of our volunteers is that we are doing surgery, and that's unique about us as opposed to people who do primary care or who go there just to hand out gifts. Is the fact that we are doing invasive procedure. So we are fully approved by PACCOM, uh, NGO, and by the Vietnamese Ministry of Health. There's a lot of process that we're going through right now is to get you Vietnam has instituted over the years and the improvement that happened over the years for them to take them out of that third world country and become more like us is that they are going through a full credentialing of each one of us as a medical provider, as a professional. Okay. Sadly, is that there are people that come to Vietnam and misrepresent themselves as doctors and nurses and do all kind of things that they are not truly doctors or nurses, or at least licensed as doctors or nurses. So it is a process that put a lot more work on our administrative team, but it's also reassured that everyone there are qualified to do the surgery and perform the professional tasks that we have designated ourselves to do for the team. So as a team, we will follow all the rules and regulation of our host country and our host hospital. We dot all the I's and cross all the T. And that is to reassure the safety of our team and the safety of our patients. So with that, I'm going to thank you everyone for attending. I really appreciate you taking out your Saturday morning. And more so, I really appreciate you signing up to be on the team and to spend the time and travel on these adventures with us together. I'm looking forward to meeting everyone again in August, and I'm excited to be working with all of you in 2 months. All right, Dũng, any last minute?
Okay, last reminder to make sure everyone to have the WhatsApp downloaded on your phone, activated, and join the team chat, because it will be quicker to communicate with everyone through WhatsApp than email, because not many people check email regularly. Okay, that's it for today.
All right.
And have a good
Okay, thank you everyone.
weekend,
Have a
everyone.
wonderful weekend.